Okay, um, so I try to make this presentation very relevant because I know everybody sees stroke, they think old people, right? So I try to make this very relevant, okay? Do you guys mind if we pray first? Let's pray. Heavenly Father, thank you for your Sabbath. Thank you for health. Thank you that you are the greatest physician and that you enable us to take care of our bodies and you empower us with knowledge. And I pray that the presentation today will help someone. Amen. All right. So, I don't think that's where I'm supposed to go, right? I think you have to put slideshow. Yeah, perfect. Am I going the wrong way? Okay, perfect. Okay, so does anybody recognize anybody on this slide? Anybody? Come on, guys. Really? Huh? You can yell out the names. That's fine. Okay. That's the one that you guys are supposed to get, huh? Who? Who? Frankie. Okay. Anybody else? No? Yes. All right. Who else? It's not Dr. Dre, no. All right, you guys, I'm very disappointed. All right, so I don't know how, there's no way to point, right? There's no pointer. Anyway, so all these people have had strokes, right? Yeah, can you imagine? Yeah, so we can start with Kid Cudi, right? That's the guy with the really nice smile at the top there with a nice cut in the blue. His name is Kid Cudi. He had a stroke at 32. Yeah. So apparently, you know, because he's a singer, he's a producer, he does all these things. And he went on they're saying a cocaine binge, I'm not really sure. And he actually had a stroke and needed physical therapy. So this is a real thing. And he was 32 when it happened. Hailey Bieber, that's the blonde lady with the blue. She had a stroke in her 20s. She's not yet 30, by the way. So she had a stroke in her 20s. Her stroke showed up as a weird sensation on the right side of her body, but it was a real stroke. She had facial droop, the whole thing. It lasted for 30 seconds. And they're saying that the risk factors for her, so she was flying, not moving much. She started on birth control. She had COVID. All right. Sharon Stone, or more seasoned people might know her. She's an actress. She's the blonde with the earrings and the black. She had a stroke at 43. She had like a thunderclap headache, and she had a brain bleed while she was at home alone. So pretty serious, right? She was 43. Frankie Nunez, that's the guy in the blazer with the brown, right? He had his first stroke when he was 27. And he had multiple strokes back to back, little strokes, little mini strokes. He would just start with his vision changing. I think he played Malcolm in the Middle, right? Right, at 27. And then Luke Perry, you guys remember 90210, maybe? He had a stroke at 52. And compared to the rest that we talked about, he actually died 5 days later. So 52 is young, right? Yeah. And then the other guy that you guys thought was who? Magic Johnson? His last name he's actually Singleton. He's actually a producer, very good producer. He also suffered from a massive stroke in his 50s and died 2 days later. Wow. Yeah. So, you know, when we think of stroke, we don't think it could happen to us. We don't think of people who are not regular people having strokes, right? So this kind of drives it home, right? You see somebody who had a stroke at 32, somebody at 27, 43, 52. You see two people who died, right? So I want this to solidify because in my practice, in the hospital where I work, the age is getting younger. Okay, I'm seeing a lot of young people with strokes, and that's a big concern for me, and that's why I'm so passionate about this. So we're gonna talk about strokes. So I did this first because I don't want people to zone out. It's not an old people problem, okay? Kind of strategic, all right. So you can't talk about stroke and not talk about the brain. The brain is so important. So if you think about it, right, if somebody passes out, God forbid, right, passes out, what are you supposed to do? You're supposed to call for help, call 911, and give them CPR. What is CPR? Like, what is it? Push on their chest, right? Stress compressions, right? And you give them breaths, right? Do you know why? Well, actually, so you give them breath to give them oxygen, right? Because in order to live, you need oxygen. But if they're down and unconscious, they can't breathe, right? Right, so you give them oxygen. What very important part of the body needs oxygen? Everything needs oxygen, but the brain is really, really, really needs oxygen, right? And why do you push on their chest? But what's right here in the chest? The heart. So you're pushing on the heart to simulate the pumping action of the heart, right? So in that way, you're pushing blood through the body. Like you're working to push blood around the body. So one of the main reasons why CPR is important is you have to send blood and oxygen to the brain. Does that make sense? Brain is very important. So we can go through the functions. It might seem boring, but let's go through them anyway. And the frontal lobe, we know is important because we always talk about the mark of the beast, right? In the frontal lobe, right? So movement, thinking, initiation, reasoning and judgment, behavior, memory, and speaking. Sounds important. The parietal lobe, which is on either side, knowing right from left, sensation, reading, body orientation, discrimination. Temporal lobe, understanding language, behavior, memory, hearing. Occipital lobe, which is back here, vision reception, visual interpretation. The cerebellum, you guys have seen on TV when the cop pulls the person over and asks them to walk, right? Take in a straight line, one foot in front of the other, close their eyes and hands out. You know why they do that? To check the cerebellum, because alcohol acts there, right? And if that's affected, you can't do that, right? Yeah, exactly. Don't do that, okay? All right. And then the brainstem, consciousness, breathing, blood pressure, heartbeat, all that stuff. Very important, the brain. And then this is kind of another reiteration, left and right hemisphere of the brain. Did it again? But this one is important because I wanted you to see something. So we think of the brain as a tissue, right? You can, I didn't have one today, but you can hold it in your hands, a tissue. But how does the brain get oxygen and blood? So this picture is showing, you see those red squiggly lines? They get blood to the brain, to the parts of the brain you need. So if those are cut off, what's gonna happen? Yeah, that part of the brain dies, right? So I want you to remember that because those lines bring oxygen to the brain. If the oxygen is cut off, it's called ischemia. What is it called? When that part of the brain dies, it's called an infarct. What did I say it was called? Right. So ischemia and infarct. Okay? Very important. I'm going to ask you later. All right. Here. I think I'm doing it wrong. Okay, sorry. Okay, here we go. All right, so this is a better picture. So for those of you who are going into medicine, I know somebody in here is going to go into medicine. This part with all the blood vessels is called the circle of Willis. You'll see it again. But it's very important. Everything that you see is red. These are roads, pathways, blood vessels, so to speak, that feed each part of the brain. And if you think about it, it's like branches of a tree, right? So it starts with really thick, and then it gets a little bit thinner, and it branches out to feed different parts of the brain, right? So looking at this picture, you can see how important it is that everything remains open. No blockages, right? Because then what's going to happen if there's a blockage? All the thinking and the walking and the speaking and the seeing is going to be affected. Does that make sense? Yeah. And this is another representation of that. So the reason I wanted to show this picture is because the internal carotid artery, that red one going down, that actually comes from the body, right? And it goes up to the brain. So if there's anything coming from the body that's not supposed to be in that vessel, and can it go to the brain and cause problems? Yeah, so see, a picture is worth 1,000 words. All right, let's talk about stroke. It's the second leading cause of death worldwide and the third leading cause of disability worldwide. What is the first? What is the first leading cause of the death worldwide? Heart disease, so close, right? So stroke is second. 10 to 15% of strokes occur in people ages 18 to 50, and that number is going up. And rates in persons under 50-year-olds on the rise. Atherosclerotic stroke, we'll talk about a little bit later. Individuals under 40 can have strokes mainly because of these problems: diabetes, hypertension, hyperlipidemia, smoking, family history. We're going to come back to that. So this is why this is important. If you look at these graphs, right, they're going up. And these have to do with diabetes and obesity. Remember I just said one of the causes of stroke is diabetes, right, and obesity. So if diabetes and obesity are going up, what else is going up? And strokes too, right? Yeah. True. Strokes, heart attack, anything that's related, right? It makes sense, right? Yeah. All right, so I was asked by your lovely Dr. Walker to present on stroke. Now, I cannot present on all of stroke. I'm going to stick to ischemic stroke, and I'll tell you why. Ischemic stroke is the most common. 87% of patients suffer from this kind of stroke. But you have the hemorrhagic stroke, the transient ischemic stroke, and cryptogenic strokes as well. Now, ischemic stroke is kind of what we talked about earlier, right? It's a blockage. You're driving down the highway, and there's a roadblock. Nothing can go through, right? That's pretty much what it is. Nothing can go through. And remember that picture that we have in our head, right? All those little red squiggly lines, right? They go somewhere, right? It's important where the blood is going. Ischemic stroke is when something blocks it. Thrombus is when something blocks it right there, right? So say, for instance, you're in your house and your neighbor next door puts tires in the street and burns them, and it's blocked right there, right? That's like thrombus. It occurs right there. Embolism, or an embolus, comes from somewhere else, right? Okay, so let me explain it in this term. So high blood pressure and cholesterol build up in the blood vessels. And Dr. Walker, do you mind passing around that model? Thank you. So there are blockages and there's damage to the blood vessels right there. And when there's a damage in the blood vessel, what happens is the little platelets in the blood come and they circle that area because they think if you get a cut, they're going to stop the bleeding, right? They're going to come and they're going to plug that area. But they do the plugging inside the vessel. So this is your body doing this. And this happens because of high blood pressure, because of diabetes, because of high cholesterol. So your body's doing this right there in the body. Now, embolism can come from somewhere else. So if you have a clot in your heart and it moves, it can go to your brain. That's what an embolus is, right? So there's so many ways that this can happen. That's why I'm telling you, we're kept by God's grace. Like, this is obvious, right? And then systemic hypoperfusion is big words just to mean that when the body's blood pressure just drops suddenly, like if somebody passes out, they can have a stroke as well, all right? Does that make sense so far? I know I'm using a lot of big words and weird stuff. Okay, so we talked about ischemic stroke being the most common. When we talked about the blood flow being obstructed, blockage in the brain cells, and what were the two words that we used earlier? So ischemia, which is the blockage, right? And infarct is when that part dies, right? So actually, the ischemia comes first, right? There's a blockage, and then later on, that part of the body dies. Because think about it, if you're not getting food, then you die, right? Does that make sense? All right, that's very important later. So we talked about atherosclerosis, and I was talking to a neurologist yesterday. It's hard to get neurologists to present because they're so busy. And brothers and sisters, by the time you come to the hospital for this, it's not the time to talk about diet. That's not the time to talk about diet and vitamins and minerals, right? This is the time to talk about it. When you come to my hospital, we're gonna treat you aggressively because at that time you had a stroke. But this is the time to talk about diet and exercise and lifestyle changes, which is why I brought this up, because small vessel diseases, which affects those tiny little branches that feed the brain, over time, you having diabetes, hypertension, high cholesterol, over time, that's damaging those vessels. You just don't feel it. And at that time, you may not have a stroke yet, but that's happening, and that's why people develop dementia. That's why people start falling. People don't understand why. But you not controlling those diseases, you're not controlling your diet, you're not following exercise and just doing the bare minimum, this is happening in your brain over time. And this is what I wanted to bring up, because this neurologist said, you know what, when they come to the hospital, we can give them medicine, but the fact is people need to watch their diet and change their lifestyles. That is the crux of this, right? So, very important. So remember I talked about the ischemic stroke, right? We talked about the thrombus, which happens right there, right? And then the embolus that comes from somewhere else, right? So heart conditions like atrial fibrillation, anybody has ever heard of that before? Okay, so let me give you a quick explanation. So you know how the heart is, right? It has 4 chambers, right? And it's supposed to squeeze the blood, right? What happens if you get a cut and the blood sits there? It clots, right? This is the body's mechanism to clot the blood, and it makes sense, right? Because you don't want to keep bleeding. It's like a mechanism that God has made in us, right? But this also can happen inside the body. So if you think about it, if the heart is not squeezing effectively, then in atrial fibrillation, it just sits there, then clots are forming. And then those clots can go to the brain. That's how that happens. PFO is when you have a hole in the heart. So if you have a hole in the heart, you're at higher risk for strokes. If you had a heart surgery, if you have a heart valve, if you have a clotting disorder, if you think about it, if you're at higher risk of clotting, you're gonna have higher risk for strokes. Okay? I think I'm going backwards. Okay. All right. I cannot reiterate this enough. So as we get older, because we don't see this until kids are like 10, 11, 12, where cholesterol starts building up in the walls of the arteries. But the older you get, the more at risk you are because of diet, like I said, smoking, cholesterol, all that stuff builds up on the walls of the vessels, and he's passing it around. But if you look at it, the vessel is not as springy as it should be, right? It becomes stiff. And because of that, when you have high blood pressure, when it moves through, like it takes those little debris with it. Does that make sense? Yeah, right? And then that's how some people get brain bleed as well. Like I said, hemorrhagic stroke, which is a bleeding stroke, which I don't have time to talk about, accounts for 13% of cases. All right, so everybody wants to know what to do about it. Time is brain. Those 2 words that we talked about, what were they again? What was the first one? Ischemia. Ischemia and infarct. Okay. Now this is where I wanted to bring you, which is why I want you to remember that. Now if you think about it, ischemia is what again? It's the blockage, right? You know, there's a blockage. Maybe no damage yet, but then what's the infarct? The tissue is dead, right? So you're trying not to get to infarct. Does that make sense? That's why time is brain. So the moment somebody has some symptoms, you guys have seen the billboard, oh, somebody has a droopy face, they can't speak, they can't move their left arm, you go to the emergency room right away. A stroke is an emergency because you could have a blockage but not have brain death as yet. Does that make sense? That's why it's so important. Not because doctors want your money. Okay? We're trying to save everybody's life. We're a community, right? A stroke is an emergency. Okay. And this is busy. I don't know, anybody can interpret anything up there, but all right, I'll explain it. All right, so when you come into the hospital, okay, so first of all, we'll have a scenario. All right, Miss Brown, hopefully nobody here is named Brown. Her face looks odd, the left side of her body is weak, and you're like, oh my goodness, she's having a stroke. The first thing you do is you call 911, right? Especially if she's nowhere close. It's an emergency. Time is tissue. It's ticking already, right? Especially if you see her, especially if an hour ago you saw her and she was okay, right? And then now she has this. We got to get on it, right? Because time is brain, right? Now, the difference is if Miss Brown went to bed at 8 p.m. and now it's 6 a.m. the next day, that's a lot of time that has passed. Now, it's not necessarily an emergency to save her brain, but it's still very important that she goes to the hospital, and I'll explain why. So the first thing that we do when you come to the hospital is what we call a CT scan. So we put you in a machine, take a picture of your brain, and pull you out. Now, that is the quickest way to identify to see if you have a stroke. The main ones being a bleed. The CT brain is able to see a brain bleed really, really well. It's not able to see strokes as soon as you have them. If you've had a stroke like a few days ago, you can identify, but a CT scan cannot identify a stroke that you had just right now, right? So the CT scan is used because it's the quickest way to see if you have a bleed, if you have a mass, something else is going on. The MRI is more sensitive. And I bring this up because I have patients that come in and they're like, oh, I'm claustrophobic, I can't have this MRI, there's no way. I know that it feels like a coffin. Like, I've had an MRI before. It's the best modality to check to see if you've had a stroke. So let's work together. Do you need me to give you something to go to sleep or take a nap? Not really out. We'll do that. But the MRI is the best test to see if you've had a stroke, because if we find out that you've had a stroke, there's stuff we can do about it at a certain point. Does that make sense? So we're asking, please work with us. MRI is the best test we have. I know it can be loud. I know it feels like you're in a coffin. I know it's scary. It's a long test, but it's the best we have right now. I know there's some centers that have an open MRI. They're a lot more expensive, or community hospitals are not going to have it. Maybe Cleveland Clinic, if you're lucky enough, may have that, but we don't. So please, MRI is the best test. We can also do the other things, but the first two are the most important when you come to the hospital. Now let's talk about treatment. So if you think about it, if you have a blockage in the road, you want to remove it, right? Right. Now, the reason why I brought up ischemia and infarct is because time matters. Because they have found through research that after 4.5 hours, that part of the brain probably died or infarcted. Does that make sense? But if it's 2 hours, 3 hours, 4 hours, you have a chance of having that blockage removed. They will probably give you what we call it a clot buster, but thrombolysis, which is removing the clot, or breaking up the clot rather. So they give you a medication, it breaks up the clot, and people do respond. And there's another procedure where they can go in and retrieve the clot. Only 10 to 15% of patients actually benefit from this or actually get this because it is such a high-risk procedure. If I give you a medication that breaks down clots and you have other things going on, you had a recent surgery, you're pregnant, then obviously you're not a candidate. So you have to be the right candidate, you have to get to the hospital at the right time, and also this medication has to be available at that hospital. So these are available, which is why time is brain. which is why it's so important. Remember I said going from from ischemia to infarct, we don't want to get to infarct, okay? That's the most important thing. All right, so you had a stroke, and you weren't able to get any of those medications, or Miss Brown rather. She still has that weakness in the right side of her body, and her face is still weird, feeling a little bit better. What's the next step? So remember I said, when there is damage to the blood vessels, right? It's because of cholesterol, and it's because the body responds to those blockages by issuing the platelets, right? And causing clots, right? So we give you medication to counteract both of those. We give you aspirin, which counteracts clots, and another medication called clopidogrel or Plavix. Some of you recognize the names. They counteract the clots. There's a method to the madness, so to speak, right? And then we'll give you medications like, I don't know, you've seen the commercials for Lipitor and Crestor, all that stuff. That counteracts the cholesterol. But on top of that, it is very important to control your blood pressure and to control your blood glucose as well, right? Because remember we said those are two of the biggest things that lead to stroke. So you can't have had a stroke and go back to living the life you were living before, right? It's really important that we effect a change. The first 24 hours in the hospital is the first thing, can we reverse it? What caused it? Did it happen right there in that part of the brain because of high blood pressure, smoking, family history, or did it come from somewhere else? Because if it came from the heart, we have to fix the heart. We have to fix the heart issue, right? And that's why you have some people who get treatment for the atrial fibrillation and so on and so forth. Then you will meet with a speech therapist. So if you have issues with swallowing, remember, if you look at the brain, the function, swallowing function is also part of brain function, right? So we have to make sure that you can swallow properly. And physical therapy, occupational therapy, nutritionist. So I'm gonna show you why we do this. And this is also part of God's favor to us, so to speak. So the neuroplasticity. So infarct happens, right? In Miss Brown, that part of her brain is infarcted. That part of her brain died that, I guess, manages her ability to move the right side of her body, right? So the fact that she still can't move that right side, or if it's very, very weak, it means that part of her brain is damaged already infarcted, right? Irreversible, right? However, the brain is so amazing, or God is so amazing, that there can be rewiring. And that's why you have to go through physical therapy and occupational therapy and speech therapy. It's called neuroplasticity, where brain cells that have been severely damaged, even though they can't grow back, the brain can rewire itself, and patients can relearn how to walk, speak, etc. Okay? So I know you know what happens when people have a stroke when you go to the hospital. These are the reasons why. And I think once you know why, it's easier to be partners in your care, right? Right. So when we say go to physical therapy, go to occupational therapy, this is why. Okay? Does that make sense? All right. Can't reiterate this enough. Those are my references. So, Dr. Walker is big on naturopathic medicine, and we join forces at this point because your diet is very important. Your lifestyle is very important. And the fact is, diet and lifestyle is important in every aspect. If you talk about heart disease, it's the same thing. If you talk about skin rashes, it's the same thing. There's nothing new. We're not reinventing anything. And as Adventists, we have the health message, but what are we doing about it, right? These things can be prevented by changing our diet and lifestyle. Like I said before, when you get to the point of stroke, please don't follow blogs that say, oh, do this, do this, do this. By that point, you need medication, you need physical therapy, you need occupational therapy. The damage is done. This is the time now to say, okay, let me see what I can do about my diet. Because I'm saying to you, if you have diabetes now and hypertension and hyperlipidemia, and if you smoke, and if you have a strong family history, you're already doing damage in your brain. It's already happening. So what can we do about it? And that's the point that I wanted to bring up today. What are we going to do about the damage that we're causing? So, I found that these presentations are not very helpful. I find that it's more helpful when people have questions. So let me hear your questions. Sure.
that. It's okay, you're young, your body can deal with it. And to some extent, it's true, they're young, but they still have to be careful because what they're finding is early diabetes. Very young kids are on blood pressure medication. So, young people, I am pleading, you have to watch your diet as well. You can't just be having all these burgers and fries and fast food, not eating your veggies and your fruits, okay? So, that's my stress. So, the question, Dr. Renee, you could address to them is how damaging are these foods to their little arteries as, young people?
That's a good question. I think I spoke earlier about them finding sclerosis in kids as young as 9. Yeah, so it's there. And childhood obesity is on the rise, by the way, right? And remember that chart, obesity going up, high blood pressure follows it, and I've seen it. So the diets, I mean, I know that when Michelle Obama came in, to work with her husband, this was her platform, and somehow it fell off. But it was the right way to go because we see kids with adult diseases. You're not supposed to have type 2 diabetes at 15, but I've seen it, right? So there's definitely a link. And we don't need a chart to see it. We see the obesity problem, we see kids coming in, and I think we need to address it. And sometimes you wonder, whose problem is it? Is it the parents? Is it the school lunches? Is it the church? Yeah, because some people don't know better. Because I remember when I did family medicine clinic, I had a parent. Well, she was an aunt. She brought her niece in who had type 2 diabetes, and she didn't know what to feed her. So there's a lot of disparity in our community, more so than any. Sure, go ahead.
Yeah, there are some popular doctors on YouTube, Sanchez, Oz, even Ben Carson. They are advertising their products and they say that diabetes is reversible. And if you take their products within 1 to 7 days, it will disappear. Blood pressure will disappear. Diabetes will disappear. Is this true?
So obviously there are reasons that people have diabetes and high blood pressure and so on. If you have a family history, if you have a propensity to these diseases, it's hard to reverse when you have a family history. However, if it's because of lifestyle, definitely reversible. I don't know about the supplements you talk about, but there's evidence. Some patients have had bariatric surgery and lost weight and have come out of diabetes and hypertension. What does that tell you? That obesity is a link. If you lose weight, you could reverse the diabetes and the high blood pressure, clearly. I don't know how many of you watch Netflix, but there's a documentary called Forks Over Knives. And they followed, I think they went to this city, I think it was like, I don't know, one of the boonies in middle America, where they did like a week-long raw food diet, and they followed them and they did all this blood work. And they could see blood pressures going down and cholesterol levels going down. So there's clearly a link to diet and obesity with food. So in my opinion, if you change your lifestyle, if you get up and walk more, because if you exercise, you increase your insulin in your body, your natural insulin, right? So exercise alone is a lifestyle change that can help. So I am not for a quick pill. I'm sorry. I also I mean, that's the same way I feel about supplements. I think if you can get what you need from your diet and your lifestyle changes, it's better for you anyway. That's my opinion. So, I mean, I don't know much about your supplements, but that would be my opinion. Yeah. Anything else? I'm sure you have more questions. The time to ask. Yes.
Two big questions. And one is, you said that, is it possible for a person to live a normal life with a hole in the heart?
People live with a hole in their heart and don't even know it. It's just that when they find out, it's probably when they've had a stroke, which is unfortunate. But there are people living with a hole in their heart and they don't know it.
Is that normal?
If a hole in the heart is normal, it's not normal. I'd rather you not have a hole in your heart, sir. Yes. Okay. Oh. Mhm. Mhm. Wow.
Said you are one of out of 100 who live like that. Our parents didn't know that we has a hole in our heart when we were a child. But I'm living until now, 76 years old. I have a lot to give. So when I say the loudest amen, brethren, you understand. Still working outside, still weeding the grass, cutting the edges. With all my daughter have camera, I still do my thing. So, God is good. Brethren, it can be done. God work on us.
I have a question, Dr. Renee. If you suspect someone is having a TIA or a stroke, and you are in the presence of aspirin, you can actually administer aspirin. Would you recommend for that person to give them aspirin if they suspect it's a stroke, considering there is ischemic or hemorrhagic stroke? What do you suggest? Should you give them aspirin if you suspect a stroke?
If they're having a heart attack, for sure. For a stroke, it's kind of tricky. So it depends. But you know, the regular person doesn't know the symptoms of a hemorrhagic stroke. What is the recommendation for American Heart Association? It's probably what I should look at. But if somebody's having a regular stroke, you know, bread and butter where it's weakness or facial droop, then I know that, you know, the recommendation is, you know, probably give them the medication. But then you don't want them to swallow if they can't swallow, because then the risk of aspiration, the aspirin could go in the lungs. So the risk is higher if they take anything by mouth. So I would probably not, you know, if it's a heart attack, absolutely. But for a suspected stroke and you don't know what their swallowing ability is, I'd probably say no. I would say call 911 and get them there as soon as possible. That would be my recommendation. Absolutely. I see it all the time. So he asked if stress can cause stroke. So, I mean, what does stress do? Everybody over there knows that it causes stroke. Yeah, so if you think about it, like if a door opened right now and a lion came in, okay, right? What's gonna happen, right? So because our bodies are built for fight or flight, right? So in the event of a threat, your adrenaline goes up, your eyes dilate, like all these things change. Now, when you're in a stressful situation, and that's every day, like home, church, school, that's how you are on a constant basis. And the stress from those hormones can cause your blood pressure to go up. And think about it, the hormone goes up, blood pressure goes up, and it stays up. And then the risk for a stroke definitely goes higher. So stress management is very important. A lot of my patients that come in don't even know they have high blood pressure, by the way. Does everybody know that you can go to Walmart and Walgreens and check your pressure? And Publix and check your weight? Yeah, right? I always say, you feel okay, but I see some numbers and I'm like, how are you okay? So when they have a stroke, it's far gone. You think about it, your blood pressure probably has been high for months. Scary, right? So, like I said, get it, at least know what your blood pressure is. And I mean, I bring up getting it done free because I know, there's, people have issues with insurance. But if you don't have issues with insurance, you have the ability to go to your doctor and get all the blood work done and check up free once per year with your insurance. Take advantage. Know what your number. Yeah, it's free. I mean, you can go again, but once a year is free. Get all the blood work done, all the cholesterol, all the diabetes checks, check your blood pressure, all that stuff. But if you have issues with insurance, I know the fire department does it, the EMS does it. You can check your blood pressure free at these pharmacies that I talked about. I don't know if your church offers that, but you do? Perfect. So yeah, take advantage.
I just wanted to go back to what Elder Ed was just asking about, the supplements,
Yeah.
because a lot of people are advising to take vitamin A, B, D, all of them. And I just wanted to know, are they really helpful?
To prevent a stroke?
No, not for stroke, but for just lifestyle.
Oh, lifestyle. I advocate for a balanced diet before all of that. If you have trouble with absorbing your vitamins, if you're anemic, if you're iron deficient, if you have vitamin D deficiency and you spend a lot of time indoors, if you have trouble absorbing B12, absolutely. But if you don't have trouble with absorbing and you can eat a balanced diet where you get all those nutrients from your fruits and vegetables, that's where you should be getting it from, in my opinion. Obviously, as you get older, the absorption of the stomach is a little bit different. Some people are on medications that affect the absorption of medications, so then those people will probably need supplements, multivitamins. But then how will you know if your vitamin D is low unless you go to your doctor and check it? If that makes sense.
Question, doctor.
Yes.
What is a heart murmur?
So a heart murmur is like is like a sound as the blood rushes across the valves in the heart. So it's like a whoosh, whoosh sound, right? So think about it. The heart is squeezing and the pressure inside the heart, when the heart contracts, it can backflow and you hear the sound, or it moves across a valve that's really tight and then it creates that sound. It's like a turbulence that you hear. Some people have murmurs and there's nothing to do. Some people have murmurs because they're anemic. There's some murmurs that need to be checked out, especially if you have symptoms. So if you're dizzy, lightheaded, chest pain, racing of the heart, if you're passing out and you have a murmur, that's something you should definitely get checked.
My last question is,
Sure.
what if you're recognizing a stroke? Taking your medication at that point in time, does it make sense?
If you think you have a stroke, sir,
You're having a stroke.
Yes.
You believe that
Uh-huh.
a stroke is coming on and you have your blood pressure medication. Would it be wise to take the medication at that point in time, or what have you?
Well, I mean, I'm assuming by this time you call 911 and they're on their way. So that's the most important thing. I did caution against taking anything by mouth, because stroke can affect the swallowing. And the worst thing that you want to happen is you can't swallow and it goes in your lungs, because those muscles are affected. So I would advise against it. I mean, at that point, we know you're having a stroke. Like, you're not impressing us by taking your medication to get your blood pressure down. We'll take care of that. And EMS will do it as well.
I had a question. Good evening, Doc. and this is kind of more race related than health related, because I wanted to ask, is there maybe an association of black cardiologists that exists right here in South Florida? Because I have a PFO, and I think I have a perfectly normal life. But anyway, I find that a lot of white cardiologists that I've seen don't seem to take my condition very seriously. And another doctor had said to me, maybe you should see someone along, your race that can understand the implications of what you have to deal with. And it's just been very difficult for me to find a black cardiologist, and I'm not sure if I'm not looking in the right places or, okay, there you go, thank you. But that's just a concern I have that.
Sure. How did you find out?
That I have a PFO
Yeah.
when I was pregnant.
Okay.
Yeah.
Okay.
Um,
Because sometimes you don't want to fix them. Did
well,
they
they
explain
haven't-
that?
Yeah, they've just left it, but I have to do these constant
Follow-ups,
checks and
echo.
follow-ups and whatever. And it's pretty harmless for me anyway. But I do find that a lot of white doctors don't seem to take it very seriously. Every time I go to the cardiologist, he's like, your heart is fine, they check this, they check that. If I express an issue that I'm having, they seem to be, oh, you're young, and I keep getting that a lot, and it's very annoying because I feel like you're not taking me seriously when I'm at home and I'm having these symptoms and I'm coming to you for help, and you're just telling me that I'm fine, but when I'm home, I don't feel fine, So it's kind of an issue that I have, and I've been through so many of them, and it's...
It's a valid concern. I always tell my patients to speak up. I mean, if you think they're not listening, you tell them, sir, I don't think you're listening to me, and I don't appreciate that. Be vocal, because this is this is supposed to be somebody you're partnering here with for your health. But absolutely, I think it's a good idea to get a second opinion from somebody that you think you might be more comfortable with, because that's not okay.
I have a question. Oh, sorry. Go ahead.
Hey, it's Dr. Ellis. Can I call you back? I'll call you back. Yes, you can get a stroke during surgery. Yeah. What happens? Hopefully not. So remember I was saying that people who have heart surgeries can have stroke, because what happened, if you think about it, remember I said that sometimes pieces of like clots or debris can float up and go to the brain from elsewhere. And if you're doing heart surgery, it's always possible because all those arteries and veins lead to the brain as well, right? So yeah, I mean, I've had patients that shower clots to the brain after surgery. It's possible.
Question, Dr. Renee, but just
Sure.
to address Sister Gray, many years ago, I passed out in church.
Wow.
And I had the two kids. Ella Period was out of the country. And I just passed out in church with a baby in my arm. I was very scared. I came to, and then I asked my niece to take me to the hospital, and she kept the kids. They did a EKG, and they said it was normal, so I'm fine, nothing to worry about. But at that time, I was working at the hospital with this cardiologist, Dr. Blanchard. He was standing next to me. You know him, right? Yes. And I was just telling him, I said, no, Dr. Blanchard, I was sitting in church, and I just passed out. And he said, you need to get it checked. I said, I did. I went to Coral Springs Hospital, and they did all this workup.
No
yes.
way.
And they said everything is fine, nothing to worry about. But then he said, you know what? He wrote me a script right there and then to get an echocardiogram. And that's where he found my condition. And so he's my cardiologist, Sachelle, and I will give you his information. He's black, he's an Adventist, and he's very caring, he's thorough. He actually lectures too. He lectures cardiology students, so he's good. But my question, Dr. Renee, sometimes when you're slim, skinny people sometimes think they're not at risk. Like, say, for example, you have a family history of hypertension and, hyperlipidemia, but you're slim and you don't have high blood pressure. Other family members have had a stroke, they also have high blood pressure. You're slim, you don't have high blood pressure. In fact, you have low blood pressure, say 100/60, but you have high cholesterol, but that's your only risk factor. How bad is that? How much at risk are you still for stroke or heart disease?
Because we know that diabetes, hypertension, high cholesterol are risk factors up there. Obviously, family history and smoking as well. Controlling the cholesterol is really important because remember I said atherosclerosis of those vessels. Think about those tiny, tiny vessels and just laying down the cholesterol on the vessel and it gets narrow and narrow and then there's nothing going through. So controlling the cholesterol is very important. Even if you cannot take a statin, nowadays they have medications that are not statins that can help. And family history of high cholesterol is such a big factor for all these vasculopathies. Strokes, heart attack, clots in the leg, clots in the lung, all those things, right? They're all risk factors. So it's really important to control even that, even though the blood pressure is not high. It's just as important. Sorry.
Sorry. Question, Doc.
Yeah.
I don't know if this is in your field, but if a person is having swollen feet, is that a sign of kidney disease or kidney problem?
So swelling in the leg, ooh, this is a big topic. So it could be fluid or protein. So if your protein level is normal, that's what you mean, like everything else is normal. Because if your protein level is low, like you're not eating healthy, you can have swelling anywhere in the body. If you have swelling in one leg, that's serious. That could be a clot, right? And then that could go to the lungs. If you have in both legs, it could be heart disease, like it could be CHF, congestive heart failure. It could be kidney too, because if you think about it, anything that prevents the fluid from moving to the heart and then, through the kidneys, then, obviously that can be a factor. So a lot of things could be going on. So it sounds like you need to get it checked, or you're asking for a friend. Uh-huh. Yeah. And it could be a sign of peripheral vascular disease, because what happens is as you get older, you think about it, large veins, right? They carry the blood back to the heart, and you're supposed to have valves in the veins that's supposed to prevent the blood from going back down. The older you get, those valves get floppy, and so the fluid, especially if you walk a lot or stand a lot, the fluid can collect. So there's a lot of things that can cause it. I don't want you to freak out.
In addition to that, question here, Doc.
Yes. Oh, I thought that was your last one before. Totally kidding.
So, I was told that blood pressure medication can cause swelling of the. Is that true?
Yes. So one particular medication, amlodipine, it's a calcium channel blocker, and it can cause swelling in the leg for some people. So if you're having that, and you can ask your doctor to switch it. All right. Okay. Yeah. Okay, so good question. How can you tell if you're having a stroke? Nobody's around you. So some people feel numbness and tingling, like out of the blue for no reason at all. My arm is tingling and numb. There's a problem. It's not going away. That could be an indication of a stroke. You can't speak, like your words won't come. That's one indication too. People have told me they stand up to walk and they're falling because their leg is weak, one or the other, or both. They can't pick up something that they were able to pick up before. Those are the main ones that you yourself can see. Obviously, if somebody's there, they can see other things happening, but those are the things that you can notice. Yeah. So, and then remember, I did show one of those celebrities. He said that his vision, he would lose his peripheral vision, and he knew. Like, you're supposed to be able to see. Yeah. So losing your vision, blurry vision, anything with your vision, huge red flag. Okay. Yeah. Thank you. Thanks for having me.